Good morning, everyone. If you're a millennial like me and active on Instagram, you must come across a lot of pages and accounts promoting mental health and asking us to take it easy when it comes to work. And we are just starting our careers. What makes it so easy for us to be stressed at such a young age? And this is not only us, but most professionals regarding of the industry face fatigue, lack of focus, and chronic stress in their work life. Burnout has become such a common occurrence that the WHO has deemed it as an official medical diagnosis. Doctors opine that 75% to 90% of all patients' medical visits are for such related ailments and complaints. With such high numbers, it is important to understand the many different ways in which stress affects our health and well being. Welcome to the latest episode of Wake Up to Health Talks. We have with us today Dr. Pranshu Agarwal from Lucknow with over a decade of psychiatric experience. And we have with him today with us to talk about stress. Welcome, Dr. Pranshu.
Thank you.
So, sir, as I was reading about stress and I was doing my research, I came to understand that stress is actually an umbrella term and there are many other terms associated with it. I wanted to understand from you what are the different kinds of stress and what basically, if stress is just an umbrella term, what are the different kinds of stress that are underneath it?
See, what we understand by stress is negative response. What it's thinking of common people that it's a negative term with negative response. But stress is not only negative, it has positive aspects too. So according to positive and negative stress, they are classified into positive stress and negative stress. Okay. Positive stress is also known as eustress and negative stress is also known as distress. What does eustress, when does eustress occur and when does distress occur? Eustress is increases your motivation to work, like for examination. You have a level of stress when you are going for an interview, when you are going to for your giving examination, you have certain level of stress there also. But up to certain level, that stress is positive because it increases your motivation to study, to do good in examination, to do good in interview. But after a certain level, if stress is too much, then that negatively affects your performance. Then you are not able to study, you are not able to pay, you have decreased concentration, attention, then that becomes distress. That is negative one. And certain life events are there which promotes eustress and which promote distress. And certain life events have both distress and eustress. Like marriage. Marriage can have positive stress also, negative stress also. Positive stress is post-marriage, your lifestyle changes. You have to you have to bear your family also, your children also, everything. But that can be positive also. But if the partner is supportive, but that can be negative if the marriage is not going good, if there are constant fights and everything is going on, marriage can be negative aspect also. So it can be classified in positive stress, that is eustress, and negative stress, that is distress.
Distress. That's actually very informative. I just thought that stress is only negative and there cannot be any positive aspect of stress. But sir, I want to understand that what actually happens in our brain when we undergo stress, and what is the medical terminology associated with it, and how does it force us to perform better or perform actually worse than what we expect?
Whenever we undergo stress, there are various changes in the brain. First of all, the hormone is released that is called cortisol. Via adrenal cortex, and which leads to release of glucocorticoids. Glucocorticoids affects our cardiac system. So whenever we are in a stress, our heartbeat increases, we have palpitations, and these kind of physical symptoms occur. Tremulousness, we have these kind of physical symptoms occur because of this. And second aspect is stress also affects our immune system, also decreases our immunity. We have talked we have talked about immunity too much in last 10 months because of corona,
Mm-hmm.
COVID. So immunity also is decreased because of stress, and stress leads to decrease in the volume of hippocampus, which is a brain area responsible for emotional and memory functions.
Mm-hmm.
So,
Yes, please continue.
so 1 minute, 1 minute. So, secondly, I'm sorry, it was a call. Secondly, it also affects in because of this stress. Psychiatric disorders happen because psychiatric disorders, anxiety disorder, depression, and all these disorders
Mm-hmm.
happen because of these kind of changes in the brain. Thank you.
So you very well said that these kind of stress that affects the body that can actually have physical symptoms as well. And I was reading that 77% of the people actually say that they regularly experience physical symptoms because of stress. Can you elaborate more on this? What are the kind of symptoms that we should look out for to associate with stress, and when should we go visit a doctor to understand whether it's actually very serious or something that can be cured at home?
Sometimes these physical symptoms manifest in the form that people understand this is some kind of a cardiac problem, cardiovascular illness. It is like palpitations occur, blood pressure when you will measure it will shoot up, means it will be increased, either too much increased or too much decreased. Sometimes people have faint also during these episodes.
Mm-hmm.
People are not able to move, their body freezes also.
Mm-hmm.
These kind of symptoms occur. So then the people go to the doctor, but general practitioner, they go and they have their ECG and everything done, because everything comes out to be normal because there is no cardiac problem in that. If there is
Mm-hmm.
some kind of abnormality, then that suggests a cardiac illness. But
Mm-hmm.
if there is no abnormality, it has occurred because of acute, any kind of acute stressor, then that suggests that it is some not because of cardiac abnormality, it is some kind of a uh, some kind of a stress response or anxiety response. One more, in simple terms, I want to make people understand what is this. Whenever we have stress, our autonomic nervous system gets activated.
Mm-hmm.
Mm, Autonomic nervous system gets activated, then the blood flow to the heart and brain increases, but blood flow to the peripheral organs decreases, because that can be understood by simple way that when we were having this COVID time, the other funds of the government were decreased. Only the medical funds, that also only COVID related activity funds were increased, other funds were cut off. So similar way, whenever we experience stress, then the blood flow to only vital organs like heart and brain is there, but
Mm-hmm.
non-vital organs like our limbs, peripheries like upper limb, hands and all, and lower limb decreases.
Mm-hmm.
So what happens is, when the blood flow to the heart and brain increases, then there is these kind of symptoms occur, like palpitations, like tremorlessness. So whenever these kind of symptoms occur, then automatically we are not to say, because people are more concerned about physical component rather than the psychic aspects of the stress. Then the people themselves will go to some kind of practitioner. But if everything is, every report is normal, like ECG, blood pressure, and everything, whatever they do, that doesn't mean that you don't have any problem. That means you need to visit to a psychiatrist or a psychologist for further evaluation of your problems.
That's brilliant. The analogy that you the blood only flows to your brain and heart and not to other limbs, and in comparison with COVID, I think that was a brilliant example, and that helped me at least understand that why is it so? Why the blood flows to the brain and the heart more than the other limbs? And sir, as you said, in the initial part that some form of stress is actually good, which you said that stress is actually good for your body. I wanted to understand that how do you differentiate between eustress and distress, and can you share some tips that we should take care of to understand, for eustress to not become distress and keep ourselves calm?
See, any kind of psychiatric disorder, all the symptoms which occur in psychiatric disorders like sleep disturbances, food disturbances, like anxiety, and all these things are occurs in every individual up to certain level. But when that affects your socio-economic and means regular day-to-day activities and functioning, your functional capability is affected, then that means that it is an illness. Then you need to go to a doctor. And you were talking about differentiating between distress and eustress. Then that means when your functional capability is affected, whenever your functional capability is affected, then that means that it is uh,
Distress.
then that means it is distress. Whenever your functional capability is not affected, that is eustress. Like, um, for example, I gave earlier also the example of examination, marriage. When there is stress in that also, you need to go to a market. There is stress in that also, and marriage is considered the factor in the scales in stress evaluation scale. It is considered one of the factor which has both distress as well as eustress. Distress in the sense, if it is a marriage is not going good, there is constant fights and constant problems, then that creates distress. But when marriage is going good, and but there are issues because you have to your lifestyle changes, everything changes, then that is a positive stress. You can say that anybody going anywhere, doing any work, like you are doing work in an office, people come and say that we have lot of stress. Office में काम बहुत ज़्यादा हो जाता है, then we have lot of stress. But that also, when we explore, then that is a daily routine for them. They are using eustress long term for that. Distress is something which the people come to the doctor for. And thirdly, you were asking tips for management. Then see, for management, first we have to recognize that it is just stress because of some kind of situation that occurred, some kind of thing that occurred, or it is because of some kind of illness. It is indicator of any psychiatric illness or any kind of psychosomatic illness. So we have to recognize that and diagnose that, and accordingly we need to treat. There are two kind of treatment, pharmacological as well as non-pharmacological. In pharmacological, certain kind of drugs, anti-anxiety, antidepressants are given depending upon the diagnosis. And for non-pharmacological, specific therapies are there, like cognitive behavior therapy is there, cognitive restructuring is there, that can be done. But what any individual for minute level of stress can do, that I am telling. What is cognitive restructuring? Just say it is told, just say if somebody hears Brahma Kumaris, then that they may be knowing. They say that thought process ko change karna hai. That only. You have to change your thought process. Looking after things, you have to change the way you look after things. Some people might have stress because of exam. Some people might not be having any kind of stress. They are waiting for giving exam because they have to go forward and give competitive exam and exceed in that. But that only. You have to change your way of looking the things. Secondly, that is common thing that you have to have your regular sleep cycle, regular fooding habits, regular exercise, because exercise and all decreases the level of cortisol and it burns off your stress, because exercise is a stress buster for many of them, because during lockdown period there was lot of increase in anxiety and all, because they were not able to do exercise because they were regularly doing earlier because gyms and all were closed. So, and after that, what you need to do, you have to have your regular timetable, like every day, your regular working hours, regular entertainment also. You need to have breaks from your regular duty. Like Sunday break is because of that only. You can have, other than that, you can have go for tours and all within 2-3 months if you can afford. If you cannot, you can go in within your city also, no problem. And you, whenever there is any problem, you need to discuss with your family members, friends, and groups. You need not to be in yourself that अब तो कुछ हो नहीं सकता है, and we need to be in ourselves. Lastly, if you are, then you can go for regular spiritual and all these spiritual. I mean not to say ki go for anyone, but spiritual the established one who are doing good, you can go for whichever religion you belong to, whichever sect you believe in, you can go there. They can help. They regular if you go, then they can help. You will receive the help that you can, that things you can do. And if at all you need help, then you need not to be late. You should go to a psychiatrist. You should not think that what people will think if I'll go to a psychiatrist. The psychiatrist or doctor for mad people. All these things not to be thought of. And whenever you need, you should take the professional help. That you need to do.
That's true. Absolutely fantastic, sir. Those were some great tips. Take regular breaks and follow a schedule, and do not feel alone when you're stressed out. Talk to your family, and if need be, actually get professional help. I think these are some things that everyone should remember. As I said in the initial part of the show, that currently so many of us feel stressed out in our jobs, in our personal life, everywhere, in all parts of our lives. It's very important to not lose that connect with ourselves and with our family members, and it's important to have everything in balance and not focus on only one aspect of our lives, and only then we'll be able to overcome stress and lead a normal and happy life. Thank you so much, Dr. Pranshu. Thank you for joining us. This has been an insightful session. And thank you, viewers, for joining us. And we'll see you in the next episode of Wake Up Health Talks.